Esposito Murray, President of the Committee for Economic Development, the Public Policy Center of the Conference Board. And welcome to CED's Leadership in Challenging Times series, where we feature the outstanding business leaders who are recipients of CED's Distinguished Leadership Awards for Corporate Citizenship and Business Stewardship. Today, I have the privilege of speaking with our 2022 honoree, Heyward Donigan, President and CEO of Rite Aid, one of the nation's leading drugstore chains, with close to 2,350 retail pharmacy locations across 17 states and over 6,300 pharmacists nationwide. Throughout the pandemic, Heyward Donigan and the team at Rite Aid have played an essential role in helping Americans defeat COVID-19. They have provided access to testing and vaccinations across the country, as well as keeping Americans informed and educated on the safety and efficacy of vaccines. To date, the organization has provided over 17 million COVID-19 vaccinations to individuals nationwide. So welcome, Heyward.
Thank you so much. Great to be here. And I'm so honored on behalf of all of our associates who did work very tirelessly through the pandemic. And certainly it's not over yet.
Yes, definitely American heroes. And so let's get started. We have a lot to talk about. You became CEO of Rite Aid in August of 2019, and you had put together a transformational plan for the company. And then COVID hit. Rite Aid's associates have been at the heart, and as we said, essential to the response to the pandemic, serving the communities on the front lines. So what were the principal leadership tools you drew on to manage through the outbreak of the pandemic? How did you set priorities?
Well, I was with the company for 6 months before the pandemic hit, and we were just really focused on putting the pharmacists out front as the people, health professionals who could engage with customers like no other healthcare professionals, trusted by the customer and really people on the front lines. And so it was ironic as we were working very hard to showcase how important the pharmacists could be in the role of healthcare for America that a pandemic hit. And it became more apparent than ever the incredible importance of the pharmacist during both the first phases of the testing and the distribution of the vaccines. So it certainly was, in a weird way, fortunate in the sense that our pharmacists really were propelled front and center into the healthcare ecosystems in ways that might not otherwise happen. But it was also an incredibly stressful time. But I think we were so motivated by the fact that we could save the world and that we could be a part of saving the world, that it was energizing and it was inspirational for our teams to be able to partner with the government and the private sector, pharmaceutical companies and testing companies to do something this meaningful and this transformational. And literally save American lives in the process. So for us, it was not like other companies maybe that weren't in the business of healthcare. This was easy for us to gravitate to. It was our purpose. It was our mission. It was fulfilling our mission and purpose in stores, mail order, distribution center, everybody who had a part of helping Americans stay healthy during a pandemic.
So you go through this 100-year pandemic, and it completely affects or gives you insights into the role of the pharmacy in the community. What were some of the main lessons that you learned during that time in terms of the role of the pharmacy in the community?
I think never in the history of the world has the entire healthcare system shut down other than emergency departments and hospitals. So doctors were for a while not available. You couldn't go into a doctor's office, and elective surgeries were shut down. And I know in my history of my life, that's never happened. So access to healthcare was extremely difficult. And we were up and running in store throughout the entire pandemic. We did not shut down for one day other than when we had somebody come down with COVID in the stores. So we became the community healthcare provider for the duration. Now, obviously, doctors' offices opened again and everything got back to normal over the last few months, but it really wasn't for quite a while that people had access to healthcare. And we provide life-saving, life-enhancing medications and didn't miss a beat to ensure that these customers continued to get their healthcare and their necessary medications. So it was a big aha moment for us as to how important this was to the continuity of healthcare for Americans. And then, of course, we started to pivot and add additional services like COVID testing and COVID vaccines. We ended up realizing also how vulnerable some of these communities were. They were vulnerable to begin with, socially vulnerable, from a healthcare perspective, very vulnerable, not good access to food, and now, of course, no access to healthcare. And so between mental health issues and physical health issues, we were really able to pivot and start going into our communities to start providing the necessary care and vaccines and education that they needed to continue to get through a really difficult time.
And so I'd like to go back to your transformational plan that you had actually created and COVID hits, and you have a vision of the modern pharmacy. So this transformational plan, was it put on hold? What were some of the elements that were accelerated by the pandemic, and what are the ones that you're actually turning to now in order to implement the transformation?
By and large, the transformation continued as planned. We were able to rebrand our company. We redid all of the exteriors of all of our stores and rebranded Elixir, our pharmacy benefit management company. And we were able to continue to change out 75% of the merchandise in stores. We reset with better for you, on trend, healthy merchandise, and didn't miss a beat, changed out all of the tagging systems, all of the uniforms, and the merchandise. So it was a pretty radical transformation in the middle of a pandemic. And we got that largely done on time, despite the supply chain issues that we experienced. The area that we weren't able to make as much progress on as I would have liked to was being able to continue to use our pharmacists to deliver more community health services because they were so busy delivering COVID vaccines and testing. So that we did have to put on hold, but we are re-energized and back on a path toward getting those pharmacists to delivering other clinical services, not just COVID, and back on track with vaccines and other clinical interventions that we do on behalf of our health plan partners.
And you're in both rural communities and inner city communities. Looking at that full experience, and CED has done a lot of thinking in terms of preparing for the next public health crisis. What are the lessons that you've learned for the next public health crisis, which many analysts have said will come much sooner than 100 years from now, probably in the next several years, given the interaction of human and animal interactions?
I think, number one, a shout out to the private sector and public government partnership that moved so fast to be able to come up with new medications, vaccines, and tests in matters of months to be able to attack and address and save lives in a public health emergency. I think that was one of the most amazing things that I personally got to witness firsthand and in close proximity. The rapidness of that and aligning with us as distribution partners was nothing short of miraculous. And so I really applaud the government, the federal government, the states, the local jurisdictions, the pharmaceutical companies, the distributors, and the pharmacists, and the doctors, of course, who all made this happen. I don't know that we would ever have imagined that we could have made it happen in that rapid succession. It is not over. I mean, we are experiencing a very significant surge in COVID as we speak. And so the battle and the crisis is not over. It's just not intensely front and center for people because people are no longer as afraid of dying. They are getting sick, and they do have treatments now, antibodies and also antivirals that are, we are providing many of those treatments and antivirals today. And of course, the vaccines still work and have saved lives. And I expect another round of vaccines as well. So we are still in the middle of this, but I think coming out of this, we are so much more prepared. We are so better. I think understanding what a next wave would look like and how we could continue to partner, because we had not prepared for this. I don't think anyone really had prepared for this. And once you go through it, you have so many lessons learned and so many experiences that you can then deploy in another iteration. But I will just reinforce that this one's not over yet.
So how did the pandemic change your leadership?
Whew. I'll tell you what, it just reinforced. I've always liked being a little bit of the underdog, and I love running a company that's small enough to be nimble, but large enough to scale. And the hustle that our team, leading a team that knows how to hustle, who was determined and resilient, I think has always been something that I pride myself in, and never before has that been more necessary. And I think just continuing to maintain that nimbleness, that determination, and that grit is what will get us through our transformation and what got us through this part of the pandemic.
And, as you mentioned earlier, what helped you at the beginning of the pandemic, this sense of a real importance of mission for everyone who works at Rite Aid in terms of their role that they played and continue to play during this incredible crisis, that global crisis that the world is facing. And then back to your leadership, there's a lot of controversy now as to the role of CEO on social issues in the United States. And Rite Aid is substantially involved in supporting healthier, more equitable communities. This is a really important value to you. What do you believe is the role of the CEO and in society's biggest challenges? And how do you decide which issues to weigh in on?
I don't think that my role as a CEO is to per se weigh in on social issues, but I have a role as a CEO to foster a diverse and inclusive culture for my associates, and not just my associates. Our customers care about this a lot, and our target growth customer, it's very important to them that we lead a sustainable, inclusive, healthy company, culture, products, merchandise. And when you're in the business of supporting your communities in healthcare, that's my focus, is how do I support my associates in our communities to drive a better workforce, a great experience for our customers, and healthy communities. And that's where my focus is.
You've mentioned how important it is to recognize that COVID, the pandemic, is not over. And looking at that, the continuing health crisis. And then also on top of that, we have unprecedented turmoil in the economy. So what are some of the most important challenges that you see ahead? And then what leadership lessons can you share that are most important to carry forward?
I really worry about the mental and physical health of the Americans coming out of COVID. And COVID is raging as we speak. And there are people who have underlying health conditions that weren't attended to during the pandemic because they couldn't get access to doctors and care the way that they normally would, or just weren't able to for a period of a year. And I can tell you, my father falls into this category. So there is a buildup in a deficit of good health care. And that I worry about. The mental health situation is real and significant, and it was a terrible problem before COVID, now exacerbated to an even more dire situation. I used to run a behavioral healthcare company. I worry about that a lot. And then I worry about the fact that people are who already have deficit in healthcare, getting COVID again, getting COVID again, getting COVID again, getting long COVID. I do think we know that can't be good for your body. And so I continue to want to make sure that we are focused on getting people caught up on their healthcare, going to the doctors, getting their screenings, getting their vaccines, getting people to the appropriate behavioral healthcare specialists, making sure that we prevent as many people from getting COVID as we can. And then those who get COVID, making sure they understand. I'm actually still surprised how few people know about Paxlovid or about the antibody treatments. And it's getting people's awareness to there are treatments available, the vaccine is still important, and making sure that it's really not, it's not okay to just keep getting it. Like, we've got to be really on top of this and make sure that we're attending to people's healthcare. So if anything, I think the situation right now is more complicated than it even was 2 years ago.
Yes, and as you noted, everyone psychologically is ready to have this so over with and to move on, and so it's so important, the cautionary notes you're making today about how it's not over yet, and it's so important to watch your health and watch your exposure, and to also curtail your own spread of the COVID to the people around you and your communities. So Heyward, it is truly our privilege this year to be honoring you. We're very much looking forward to seeing you in New York in October. And thank you for joining us today and for sharing your insights.
It's such an incredible honor, and I really appreciate the time, and I look forward to seeing everybody in October.
Great. Well, thank you.
Thank you. Take care.